Earlier this week, the National Consumers League released a very interesting survey on one of the hottest topics in the news recently, vaccinations, or the lack of. Joining me on the phone is Rebecca Burkholder. Rebecca is the Vice President of Health Policy at the National Consumers League, and I'll refer to that as the NCL from this point on. Good afternoon, Rebecca, and thanks for talking to me today about the survey.
Good afternoon, Robert, and thanks for inviting me to be part of the show.
Absolutely. Now, there are several major topics in the world of vaccinations addressed in this survey, and the issue of the vaccine-autism link is looked at from several different angles. What did you find when parents of children under the age of 18 were asked if vaccines cause autism?
Sure. Well, Robert, we found in this survey that we conducted with over 1,700 adults, including parents of kids under 18, that a third of parents, 33%, and a similar proportion of adults agreed with the statement, vaccinations cause autism. And this is really troubling because scientific studies have clarified that there is no link between vaccination and autism, and we are concerned about this survey result.
All right, well, and the survey also notes that 50% of parents are aware of the Wakefield study from the late 90s that linked autism to childhood vaccinations. But only half of these parents are aware that the study has been since debunked and retracted in The Lancet. So there's a lot of misinformation out there. What did your survey say where people are getting their information about vaccines from?
Well, we do know that parents turn to a number of sources for information. The vast majority, over 80%, find healthcare providers to be their trusted source of information about vaccines. Now, more than a third trust web-based sources, about 37%, and behind that is the Centers for Disease Control at 32%. 22% trust family for source of information about vaccines, and about 1 in 10 parents, Robert, go to their child's school for trusted information about vaccines. We found that about 7% trust in television personalities to relay information on vaccines. Now, 7% is small, but scary health information can obviously travel very quickly, even if it comes from a small source like that. So we do know that consumers in general turn to a number of different sources for health information, but healthcare providers continue to be that most trusted source for information about vaccines.
Okay. And this next question, I'm not sure if you covered it in the survey, and it may be an opinion. I mean, you can answer it if you can. But, you know, I get it. There's an anti-government mood in America today. But the fact that more people trust looking at various websites over the experts at the CDC, I found a little odd. Can you talk a little bit about this? And is there a lack of trust in the government when it comes to this issue?
Well, Robert, it's an interesting question. I mean, the thing is, we actually found that there's a lot of support for a mandatory vaccination policy as well. Now, the strongest relationship as a source of information about health seems to be people's healthcare providers, but we do know that people get health information from a variety of sources. So, you know, it may be their healthcare provider, it may be government websites, it may be other websites. The thing is, patients don't always understand that on origin, a lot of their information that they're actually getting from their healthcare professional can come from the federal government guidelines as well. But it all seems to come back to that relationship that the consumer has with their healthcare provider. And for many people, their healthcare provider is who they partner with for their health and who they trust as a source of information. So even if there is this anti-government mood, as you suggest, we did find, interestingly enough, that there is a lot of support for mandatory vaccination policy.
Right, yeah, and I want to get to that in a little bit. You mentioned in the NCL press release that was released on Wednesday that clearly we're paying a price for this misinformation also. Mm-hmm. And can you elaborate on that at all?
Sure. You know, the thing is, we forget very quickly that a generation ago, children had polio and wore braces on their legs or ended up in an iron lung. And back then, parents were scared to death of the disease, and the vaccine dramatically decreased childhood deaths. There are some recent examples, Robert, of the reemergence of diseases caused by failure to vaccinate. Just this past month in March, there was an outbreak of mumps on the Ohio State University that infected nearly 70 people. Nearly 30 people were infected with mumps after an outbreak at Fordham University. And in New York City recently, they warned of a measles outbreak that infected over 16 people. In the case of measles, the CDC has reported recently that measles elimination has been maintained in the U.S. since 2000, but we are seeing this increase in cases. And for each of these outbreaks, transmission of the disease occurred in those pockets of persons that have been unvaccinated. And, Robert, one thing I wanted to emphasize is, when we did this survey, we did find that we're aware that parents really care deeply about the health of their children and want to do what is best for them. But when misinformation really goes viral, it's hard to get that under control. And a parent's job is to protect their kids. And in this case, what they're doing is they're weighing that need to protect against autism versus protecting against polio and other diseases. So we really think the survey shows the results of power of fear and bad information. So when parents hear through TV talk shows, a friend on the internet, in the news, that vaccines can possibly do harm to their children, they take that to heart. The threat of autism is scary, and we are finding people are confused about this link, and we want to make sure they're going to their healthcare provider to ask those questions and get the information they need.
Very good. And I'd just like to go ahead and clarify a little bit about the Ohio State mumps outbreak. That is over 100. I got a press release today from the health department up there. So,
well, thank you for that clarification.
It continues to grow. That's the point I'm trying to make. The issue of individual choice is also addressed in the survey. What are the Americans that were surveyed, what do they say?
Well, we're finding that Americans do strongly support, as I mentioned, mandatory vaccination for school-age children. They see the value in vaccines. Nearly three-quarters say they're concerned about the drop in vaccination rate, and over 80% agree that vaccinations help reduce healthcare costs. At the same time, we're also finding that when parents are asked who should have that final say if a child receives a vaccination, 76% say that parents or guardians should have that final say. And over half of adults, 60%, say they respect the decision of parents when choosing whether or not to vaccinate their children. And almost 90% of adults report that they support medical reasons for refusing mandatory vaccinations. But, interestingly, they're less likely to say they support religious, 44%, or philosophical objections, at 33%. So, while we see this value of vaccines, that people understand the value of personal choice as well. So it seems to be balancing those issues. In some ways, we're hopeful of the direction that we're heading, that people understand the value of vaccines for the overall health of the community, but they still see the individual choice as a very sacred choice. So really, it's this kind of continual balancing of personal choice versus community health.
Yeah, very good. And there was a couple of numbers that kind of confused me a little bit, and hopefully you can clarify. The survey said that more than 8 out of 10 parents and adults supported mandatory vaccinations for school-age children. You've mentioned that already. However, if 1/3 of parents of children think that vaccinations cause autism, to me that doesn't add up. Any thoughts on that?
Well, we think it just shows that people are continuing to question and search for answers and information. And the survey shows the power of that information and how that can travel, too. People are still confused and, as I said, are balancing that personal information and the cost of not vaccinating. And it's why we're telling people, talk to their healthcare professional about vaccinations and the questions and concerns they may have. This is really the best source of information for parents as they navigate this issue and make those choices for themselves and their family.
All right, Rebecca, the last question about the survey. If you were to look at the survey as a whole, what's the headline? What's the main point of the survey? What did you get out of it?
I think the main point of the survey is that parents continue to mistakenly link vaccines to autism, and they need to make sure they're going to clear information about this issue. The other thing, Robert, I'd like to point out is that while we've been talking about this headline from the survey that over a third are linking vaccination to autism. It was interesting when we delved a little deeper and asked people if they knew someone with autism and if they believed that that person's autism was caused by the vaccination, then only 1 in 10 think that's the case. So when it comes down to that personal issue, when people step back a little bit, they seem to step away from some of the hysteria around this issue and have more of a reasonable approach. So again, we think it comes down to good information, that there is this mistaken belief that vaccines can cause autism, and people need to make sure they're going to good sources of information.
Well, that's great, because that last little piece of data is definitely reassuring. Rebecca, before I let you go ahead and take a minute to talk about the survey, how it was conducted, and tell my listeners a little bit more about the work of the NCL.
Yes, I'd be happy to, Robert. The National Consumers League is a nonprofit consumer advocacy group. We've been working on behalf of consumers and workers for over 115 years now. And we have long worked to help consumers understand health risks in order that they can make the best possible choices for themselves and their families. We conducted this specific survey in order to explore consumer attitudes and behaviors around vaccinations, especially for parents. In partnership with Harris Poll, we surveyed 1,756 adults, of whom 993 were parents of children under the age of 18. We actually, Robert, conducted the survey at the beginning of flu season this past winter to find out about attitudes around the flu vaccine, and did find that, people are not always understanding the seriousness of the flu and often mistakenly believe that the vaccine can actually cause the flu. So we're happy to share the survey results. People can visit the National Consumers League website at nclnet.org for more information.
Absolutely, and I encourage listeners to go to that website and check it out. It's certainly eye-opening. I've been talking to Rebecca Burkholder with the National Consumers League. Thank you, Rebecca, for your expertise. I appreciate it.
Thank you, Robert.
Okay, have a nice day.
Great, thank you.
Bye-bye.